In this video, we're going to review Module 1B of ARIA Training. So first, on the side here, you'll notice action buttons. The three most important ones are the first one here, which is open. So that will actually open the patient chart. So either by double clicking the patient or just selecting them and then clicking open, that'll open the chart. The next one down is view. So for this one here, this makes it so that you can access patient demographics without having to go into the patient chart. So you'll select the patient and hit view. This information here is available in the patient chart as well, but it's a nice quick look if you need it. So just to review the tabs, the general tab here is going to show you the patient's name, date of birth, gender, country, whether they're deceased, their address, contact information. As well, there's a piece down here for hospice care that we're not currently using, but it can also show you if the patient's clinical trials and if they're a test patient, things like that. Under IDs, this will show you their unit number and MCP. So if their MCP and unit number vary, this is where you can get both values. Temporary address is only used in specific situations. If we have a patient that's from outside of St. John's area and they've come in for a short period of time for treatment, then they can add a temporary address for their appointments to be sent to. It is important that once they're finished their time out here and they move back home, that this temporary address is removed. Otherwise, all appointments will continue to go to this temporary address. Next is contacts. This information will show you next of kin or emergency contacts. So this information comes from Meditech. But if there is an instance where they want to add, a patient would like to add another person to their contacts, they definitely can. So just in line with what came over from Meditech, what you can do is hit modify and select new, and then you can add another one if it's within your user rights to do so. You can also go over to demographics. This is going to pull information straight from Meditech. So some of this is helpful and some isn't. This piece here for gender identity, sexual orientation, these are pieces that aren't in Meditech, but we can add ourselves. So if you wanted to add this here, then you can, and gender identity as well. And then providers is going to show you the internal physicians. So this section will have physicians that are from the cancer center that are following or assigned to this patient. And then other providers, this will include family physician only. So there should only ever be one physician here. If there's more than one, it's the responsibility of clerical to review this and make sure the most up-to-date name is only here. Under the referrals tab, this one here will show you physicians that have referred that patient into the cancer center, and this will show you any physicians in the region. So if this patient is getting chemotherapy in one of our regional sites, they might be followed by a GPO or medical internist, and their name would be here for you as well. And we don't use photographer preferences. So as you can notice, if there is a gray tab, it's not that you can't access it, it's just that there's no information in it. Overall, this demographics tab is filled from Meditech. So when a patient registers, that information flows into here and we'll update it. So it's very important that if a patient has a change in their telephone or their contacts, that it goes through the front desk clerical who can re-register them through Meditech. Otherwise, if you do change something in here, it will only refresh the next time Meditech registration is completed. So that's your demographics window here. The only other button on this side that we use is schedule. So just to review, it's open, view, and schedule. So your schedule button is also available when you're inside the patient chart, but it's nice for a nice quick look if you need to review as well. So this will show you any appointments that have been booked within the cancer center, and will also show appointments that have been filtered over from Meditech. So this here can show you through the calendar what appointments there might be. So if you look at November, the blue means that there's two days where there's scheduled appointments, and you can see there's no pink. But if we come over to December on the 27th, that's a planned visit. So this means that there's nothing actually booked to it yet, but it is a space holder for chemotherapy. But it's important that if you don't see any extra details in here, that means that an appointment has not been booked yet. And then yellow means it's the selected date. So if I select the 29th, you can now see the blue here is selected. So from this, you can see the planned visit, who the patient's being booked to, the time of the appointment, the date, and if there's any further information. So for this one here, you can see a little piece of paper with lines. So you can click this, and this will give you more information on that appointment. As well, down here, you can show two different settings for viewing. Of course, this gives a collapsed view. So if you'd like a little bit more detail, then you can have it this way. And if you want to see canceled visits, you can click this as well. For canceled visits, of course, we don't have an example here, but if there was a canceled visit, you can view it as well to get a little bit more detail on it. So you could select it and hit view, and you can see the actual appointment and make sure you had all the details. You can also print appointments from this window. It's not the way that Clerical prints them. We have a report that we use for that. But if you want to quickly print an appointment, you can just by selecting it and hitting print. So on our icons here, we have the high priority patient comment. So if that patient already has this icon here, you can add another patient comment from here just by clicking it. And when you click the icon, if there's another comment that needs to be added, you can just select new and you can add whatever the comment is and then hit OK. So you leave the rest of this as is. You only need to add your message. So high priority comments are something that you want all staff members to be able to see because it's something that everyone needs to know about. So it has to be something that doesn't break confidentiality. As well, you can error one out if by accident you didn't mean to have it there just by clicking error and then hit OK. And then if something was no longer relevant, you can also inactivate. So just by clicking inactivate and hit OK. And you can still see the inactives or the errors just by clicking these filters as well. If the patient doesn't have a high priority comment icon here, you can still add one. You'll have to open up the patient chart. So we select the patient and click open. And it's under the history icon. And then you hit the comments tab here. So on the comments tab, it's the exact same window we just seen. And this is where you can add a high priority comment if the patient doesn't already have one. There are other patient status icons here as well. For the most part, they can be added through one way, which is opening the patient chart, selecting workup, patient status icons, and this will show you a large list of options here. Many we aren't using, and as you go through, you'll find which ones you're using, which you aren't. But if it's a patient that's on concurrent chemoradiation, they might have this icon. If they require a support person, this icon may be used when we're in lockdown related to different issues, and we might limit the number of people coming in. This icon lets us know that that patient can have someone with them. This shows that they have a risk of falls. Of course, this one is same name alert. You can scroll down as well. We have our code status, and our smoking cessation icon is used if that patient is a current smoker, and it's a flag so that we can promote the smoking cessation program. And the compassionate access is used by nursing as well for patients who are on an injection that's covered by the drug company, and we pick those injections up at the pharmacy. So these different icons, depending, will be added by specific disciplines. And it's just to select the appropriate icon and hit OK. And then to remove it, it's just as simple to go workup, patient status icon, and then deselecting it and hitting OK. And as you can see, that icon's come off. There are other icons that aren't attached to this section. So as you can see, we have the allergies icon and the infection control icons and the clinical trials icon. So these can be added in different ways. The infection control will be added by health records, and allergy icon will activate once an allergy is entered on that patient. And that is done through the history icon, which we'll review in another module. Next, we're going to review reminders. Reminders are used to communicate with other ARIA users about a patient. They are not an email and they are not used for personal use. They are specific to that patient and they are a part of the patient chart. It's important to keep this in mind and to make sure that our messages in this are professional. So when we open a patient chart, we can see here the reminders icon. And so this is a way that you can send a message either to a physician or clerical staff or allied health professional or nursing if something's required. So to send a reminder, you hit new, and then you have the option to make it time critical. By selecting time critical, it's going to make an icon like this appear on the account of the user you're sending the reminder to. So it's a little flag that it's more urgent. So you can pick between personal and discipline reminders. Personal will send it to a specific user, while discipline will send it to an entire discipline. Every user is attached to a discipline. So to send a personal reminder, you find your name and select it there. You can also hit the flashlight and either select one or you can hit multiple users. As you can see, multi-select is there. So if you wanted to send a message to multiple people, you can using the flashlight. And then once you have your user selected, you enter your message. It's important not to say hi or have any descriptors like that. It's more important just to put the phrase down or for what's required or what's needed, as this is part of the patient chart. And then once your message is completed, you can hit OK, and that will send it. If there's an instance where you've sent it by mistake or it's not complete, or the message you sent is no longer relevant and it's not needed for the sender, if you select disregard, it will take it away so that the physician or allied health person or other user that you're sending it to no longer sees the message. I would only recommend doing this if it's an error. Otherwise, it's better to leave it as sent. You can also review your own reminders. So there are several ways to do that. So to review your own reminders, we're just going to close here. There's an option here for provider approval. So if you click this icon, it's going to show you things related to this user that haven't been approved. So if there are any notes that they have written that haven't been approved, if there's any reminders that need to be reviewed, physician orders, and so on. So based on different disciplines, you'll have different things in your provider approval queue that you will need to review. It's just a double check to let you know if there's things that were missed. So for personal reminders, you can see here that we have 6. So if we click that magnifying glass, it'll bring us right to our reminders. And you can see the patient name. If you see a little red star here, that means that that is a time critical reminder. So for these reminders, what you'll end up doing to view them, you can just select the reminder. If you hit approve, it's important to understand that once you hit approve here, this will disappear off your screen. So it's important to only approve a reminder once you're completed the job, otherwise it disappears. If that instance does occur where you do approve a reminder before you've done the work, please contact your area clinical support staff and they'll help you with that. You can also forward a reply to a reminder. So if you wanted to reply, all you have to do is click the reply button and it'll send it right back to the source. And you can just hit OK. And you can also forward. So if you receive a reminder that's best suited for someone else, you can just select from the list. And again, you could also use the flashlight and use the multi-select. And the other piece here is disregard. There's never an instance really where you need to disregard a reminder that you've received. You're better off just approving it if there's no work that needs to be done. And you can also just view them. So if you're not ready to approve or and you just wanted to look at the reminder, then you can just hit view. If you want to be able to go right to the patient chart to review after receiving that reminder, just select the patient reminder and hit this little icon here with the arrow file. And this will bring you right into the patient chart for you to be able to review in more depth. And it kind of helps give you context for that reminder. So otherwise, you can also click refresh if there's more reminders that have come down for you to be able to see, and you can hit close. So it's important to remember that this is the best way to review your reminders. The little icon here has now disappeared because I've approved the time critical reminder that was there. The other thing we can do is check discipline reminders. This is going to be for very specific instances because certain disciplines may not receive reminders while others may receive many. So when you come under this tab here, you can see that it has a limited date range, but it will show you any personal and discipline reminders. So there's a couple things to keep an eye on. So if you're looking here, just make sure that you change your date range so it goes back a couple of weeks in case there's anything that might be missed. And if there are any discipline reminders, they'll appear here in this column with a little check mark. And the same for personal, they'll appear here along this column with a little check mark. To go to the reminders, all you need to do is double click the check mark and it'll bring you right into the reminder. For troubleshooting ARIA, if you do have any issues, you can review the help button here with the icon legend and contents and index. And you can also contact your area clinical support team. That information will be provided with you during orientation. There are broadcast messages that can be sent through ARIA. These will appear when you log into ARIA, and it's in very specific instances. So if you see those, it's just to let everyone know something new or an update with ARIA. As well, when you go to exit from ARIA, it's important not to use this X, as using these can sometimes make it difficult for you to sign back in later. So make sure that when you do go to sign out of ARIA, you hit File and Exit Manager. In another instance, if you do go from one computer to another computer to log in, it's very important that you exit out from the first computer you were on before you go to the next. And that's the completion of Module 1B. Thank you.